We ready to roll? Okay, well, it's great to be back here in Sullivan County in Monticello Courthouse. And I want to thank Dr. Rahul Gupta. He came up from Washington at my request and has been extremely helpful to us in what we're about to announce. And he's the Director of the Office of National Drug Control Policy, the ONDCP. I want to thank somebody who's been an inspiration to me for 20 years with the work he's done on the HIDTA and that I've done as well. He acquainted me with HIDTA when he worked for Governor Pataki. It was, where do you go? There you are. And we've worked with him ever since, and that is Chauncey Parker, the director of the New York, New Jersey HIDTA. We have Wendy Brown. She is the former Drug Task Force co-chair. She was the first person who contacted us about the need for the HIDTA, and we thank you very much, Wendy. We have our great sheriff, Mike Schiff, who is very much involved in helping us with our meetings. Where'd he go? Okay. And the acting district attorney, Brian Conity. He's the Drug Task Force co-chair and has been our acting AG since I was last here. You're still acting?
Still acting.
When does it change?
November.
Oh, okay. Good luck. Thank you. All right. And so many other leaders of this county, because this is so very important, what we're about to announce today. So I want to thank everyone for being here. This has been an incredible journey that started over 3 years ago when I joined forces with Sullivan County's former Drug Task Force chairs, Wendy Brown still, and Megan Galligan, who was then the DA. Back then, unfortunately, still today, Sullivan County faces a harsh reality: the highest per capita overdose rate in the whole state. It's not the highest in number because it's not that big a county, but per capita it is, and that's a very important and worrisome statistic that we have to do something about. Despite this, even though they had the highest per capita, they were the only county in the Hudson Valley that didn't have a HIDTA designation, meaning it lacked the federal resources to which are critical to stopping the dangerous drug traffickers and cut out the supply of drugs like opioids in our community. In a meeting in February of 22, I promised the Drug Task Force and the community I would not stop fighting until we got this designation done, and to make sure that the community suffered in silence no longer. And I'd use my voice and my clout as the majority leader of the United States Senate to get it done. It's pretty good to have a majority leader from the state of New York. I'm the first one ever. I try to use my clout for New York. So as Senate Majority Leader, I've always fought that Dr. Gupta's agency, ONDCP, get fully funded, because I know how important fighting the scourge of drug trafficking is. Every one of us knows someone in our family or a friend who has lost someone to drug overdose. The number has increased. I just saw statistics that now more young people die of drug overdose than any other cause. Even automobile accidents are not as high. And so we've always fought to fund it. And we were able to include $302 million for HIDTA in the fiscal year 23 appropriations bill. And that was an increase. We didn't get many increases in these tough times, but we did for HIDTA from last year. Well, I have great news. Today is the day the tide turns in our war against drug overdose and drugs in Sullivan County. I'm proud to announce that Sullivan County has officially received the HIDTA designation. I led this effort at the federal level, but I do want to say that without Wendy and Megan's leadership, and the leadership of so many who are behind me, this wouldn't have happened. The task force is an inspiring effort, bringing together partners from both the public safety and public health communities to confront this crisis head on. And I've worked with them. We need law enforcement. We need to stop the scourge of drugs coming here. And we also need health, because we need to, when people are addicted or might be addicted, we need to treat them. And there's a shortage of both. So securing an ultra-competitive HIDTA designation was always going to be challenging, especially here in a rural county like Sullivan. We face a chicken and egg problem here in Sullivan. We did. Without the HIDTA designation, we lack the resources and expertise to apply. Last year, only 30% of the applications were approved. But you know, my father passed away, he was 98, a year and a half ago. But he's still here. Those of you who lost parents or you might be close to know what I mean when I say he's still here. And he said to me that if you're doing something that's important to you, look in your heart, make sure it's the right thing to do. And if it is, persist and persist and persist. And God will reward you and you'll succeed. Well, that's a model here for what happened in Sullivan County. We persisted and persisted and persisted, and now we have succeeded. We weren't going to let the cycle of drugs flowing into this community, the number of overdoses continuing to increase. So now all of these calls, letters, and visits have paid off. Now Sullivan has access to the federal tools to save lives. Now this is not, the HIDTA designation is not just a title, it's a lifeline. It equips this county with the resources and intelligence and where the drug traffickers are and where the drugs are coming from and what is in those drugs. Because it's different in this. Some could have, you know, many have fentanyl, some could have xylazine. Different ways of treating each of them, countering each of them. And so that's going to be here. We're going to have federal law enforcement backing, both in terms of knowing where the drugs are coming from, both in terms of analysis. A county like this depends on the federal government for these kinds of things more than any. And 99% of the drugs that cause the drug overdoses here, probably 100%, don't come from this county. So the county can't do it on its own. And the HIDTA does something by linking them up with other HIDTAs around the state and in New Jersey, because some of the drugs come up through New Jersey, and with the federal government and federal law enforcement. And the money is flexible. If Sullivan County thinks they have a particular need in personnel, in prosecution, in health care, in treatment, a HIDTA can help and will. So that's very, very, very important. So again, I thank everyone for doing this, and I'm now going to turn it over. There's now a healthier, brighter tomorrow for this county because of today. With that, I'm going to turn it over to the great Dr. Gupta.
Well, thank you, Leader Schumer. Very much appreciate your persistence on behalf of the people of Sullivan County here and on behalf of New Yorkers. Really creates miracles. And today is one of those areas where your hard work and your calls to me, as you described, have been so important. I'm thrilled here to be able to help Sullivan County welcome into the White House's High Intensity Drug Trafficking Areas Program, or HIDTA program. And from my vantage point, this is certainly a win, because I'll tell you, I was just in Randolph County in Elkins, West Virginia yesterday, a rural county, not very different. Today we went in, to start out, we went to a coffee shop this morning, and the lady had a medical issue with her daughter, had to close up, but she still made the coffee for all four of us. And that coffee were from 10 different countries. She said, which one? I couldn't tell. I said, give me your best one. So this is the kind of thing that you can find here, right here in Sullivan County. You know, you're seeing growing levels of drug crimes, especially drug trafficking around Route 17. And that's why your coordination of the law enforcement resources is so critical. And you've got to get this problem under control and keep your community safe. And this is where this designation becomes important. Mike Schiff, the sheriff here, is working hard. We know that. Of course, my good friend Chauncey Parker is really working hard as well on your behalf. Now, this designation will unlock new capabilities and new resources to fight drug trafficking in the county and really help make all of Hudson Valley safer. This is a force multiplier, and that's the kind of thing that the Biden-Harris administration is working historically to disrupt commerce of drug trafficking. We're not only going after a single drug, but the entire commerce, and go after getting historic levels of seizures and significant increases in sanctions against Mexican and Chinese traffickers. Now, you're one of the only 9 counties across the United States that has this new designation that will have additional resources deployed across the United States that you will be part of now. As we know, HIDTA program is effective. You may say, why? Let me give you some examples. Just last year, HIDTA program seized 26,000 pounds of fentanyl, 26,000 pounds. And it denied drug traffickers $22 billion in profits with a B. Now, every dollar that taxpayers invest in HIDTA, you get $83 in return. In my view, that's the best return on investment. Now, right here in the New Jersey, New York, HIDTA area, 1,800 pounds of fentanyl was seized and more than $300 million was seized. So thank you to the team. Thank you to Chauncey Parker for the work. And I'll tell you, this designation makes this county and the valley safer immediately because of the work that's going to start. I really want to, again, recognize Leader Schumer's commitment and his non-stop advocacy, as you heard about today. He's been working on this for years because the safety of the residents of Hudson Valley matter. And it matters because it's high on his list, and I want to appreciate you for all that hard work. And I'm thrilled here to be standing next to him because the work today, this designation today, will save lives. It's as simple as that. I also want to recognize, again, the work of the brave women and men of HIDTA, working local, state, federal law enforcement every single day. Now, the DA's office, again, Sheriff's office, all of these are our partners, and this is the magic that happened with HIDTA. And we're here because your persistence throughout, and what it means is that help is on the way. There will be more intelligence sharing for drug traffickers who are preying on vulnerable New Yorkers. Now, drug traffickers are going to find out what it means to have Sullivan County added to HIDTA very soon. President Biden's national drug control strategy has two components to it: drug trafficking profits, going after them, and creating an addiction treatment infrastructure. These are two sides of the same coin. At a time, we've lost 100,000 plus people across the country, more than 6,600 people in New York. We need every tool in our toolbox. And that means recognizing threats like fentanyl mixed with xylazine early, another area where Leader Schumer has been a leader on this, working urgently to take actions. It also means that ensuring that everyone who needs treatment can get treatment. We get naloxone and Narcan everywhere we can. And thanks to the government funding bill that the leader was able to get to President Biden's desk, now every prescriber of controlled substances can provide treatment. We went from 129,000 doctors to 2 million overnight because of the one signature of that pen. Now we got to expand and continue to expand and bring those resources home. And I want to again thank Leader Schumer for that bill. Now our work means we got to crack down on illicit fentanyl at every choke point in the supply chain. At the border, I was there last week, saw the tunnels, saw the border, saw how non-intrusive technology increased by 445%. 38 million pills they've seized already. We've got to make sure the HIDTA is fully resourced to the extent it can be. And I'll tell you, Sheriff from South Dakota said to me, HIDTA program is an unsung success story. So that's why we're here, and part of this is I'm singing the praises because, again, without leaders like Leader Schumer, we're not going to be able to do this. And his strong support at HIDTA program and our drug-free communities program for youth prevention has been so critical over the years. He's been a champion for good drug policy and a champion for the people of New York. I want to congratulate Sullivan County again on this designation. Working together, we can make this goal a reality. Now, working together, we're going to stop drug traffickers and save lives. And as President Biden likes to say it, we can, working together, beat this epidemic. So thank you for having me.
Thank you, Dr. Gupta. Appreciate it. Now we have the great Chauncey Parker, the director of the New York, New Jersey HIDTA.
Thank you, Senator. This truly is it's a great day for the New York, New Jersey HIDTA. It's a great day for Sullivan County. The HIDTA program is really an amazing program which Senator Schumer has recognized in the 20 plus years that we've known each other. It's a very basic concept, but HIDTA is a program that invests in partnerships between law enforcement agencies and their community health partners to build safer and healthier communities. That's it. It's ideologically agnostic. Just keep people safe, keep people safe, keep people safe, and keep reducing the drug overdose deaths. I've known Senator Schumer, as he said, for many, many years. And I just want to say a couple of things. The New York, New Jersey HIDTA started with 5 counties. And now, in New York State, we have a total of 23, on top of the 5 that we originally. Additional 23 counties, Sullivan County today, is because of the relentless support of Senator Schumer for this program. And it hasn't been just for New York State and New York and New Jersey. There was a time about 15 years ago where the federal government was thinking of actually eliminating the HIDTA program.
Yes, I remember.
And Senator Schumer stood alone, and I think I was to your side, but I think you were alone at a podium in Staten Island talking about that right at the avalanche of this opiate epidemic and saying the one thing you can't cut is this program. This is the thing that brings us all together for a common North Star. You can't cut this program. And step by step, he brought the rest of the leadership with him, and that's why we have this program today. I also want to say this about Dr. Gupta. Imagine the wisdom and the importance of President Biden putting an esteemed doctor to be the director of the Office of National Drug Control Policy, who understands first and foremost this is a public health crisis, and he understands the importance of law enforcement and all the other partners to accomplish this common North Star. So we're so lucky to have someone as esteemed and distinguished leading our national drug control strategy. Final thing I want to say is about this remarkable Sullivan County partnership. And we all rolled up our sleeves and worked side by side. I think you're a model, not just for the state, you're a model for the country. Because what you do is you Republican, Democrat, liberal, nobody knew where anybody came from that way. You all just shared a common vision for doing better for the people in this county, and you also shared a common vision that the only way you could do that was by working together. And remarkably, you took what I would say was an okay application, and I think Dr. Gupta, with a lot of push from Senator Schumer and the whole team, but you really have delivered an exceptional application to justify this designation, and it truly will save lives in this county. So I'm honored to be a part of this team. Thank you.
Thanks, Chauncey. Okay, now we have Lindsay Brown, who's the former Drug Task Force co-chair. She was the first person who brought this to my attention.
Hi, it's an honor to be here. I'm not going to take everybody's time because we're all warm, and the good news is out. Sullivan County is now a safer place. Our children are safer, our families are safer, and our streets will be safer. And as Senator and Dr. Gupta said, the message is out. The gloves are coming off. I can't say enough about the phenomenal law enforcement community, the support we've gotten from the CAC and the HIDTA team, the support from public health, and the support from the legislator here in the county. It's a great day. We're moving forward. There's going to be a lot of hard work, but you know what? The little county who couldn't now can. So congratulations to everybody, and thank you so much.
He's a man of few words, but good action.
Good morning. I'd just like to say this HIDTA designation is a game changer for Sullivan County. It gives us the ability to move forward. A lot of work went into this. For my part, I feel like I was a cheerleader, but there were a lot of people in law enforcement, DA's office, public health, politicians on the county level, local level, state level, and especially the federal level that put in the hard work and the countless hours to make this happen. I'm not going to thank everybody by name because I know I would miss somebody, but I would be remiss if I did not say Senator Schumer promised he'd get us through this. He's been back here several times. He kept his word. He did not forget Sullivan County. He came back with the HIDTA designation, and I have to thank him by name, and thank you, Senator Schumer. This HIDTA designation will give us the ability, equipment, and finances to move forward and make Sullivan County a safer place for our citizens. I would also be remiss, I think, not to thank Dr. Gupta for coming up this far, for helping us through this program, and then making this trip. I think a lot of other people might have helped with the paperwork and not made this trip up here, which I'm sure in the middle of the summer, everyone is very busy. So I'd like to thank you personally also. That's all I got.
And our last speaker is our acting DA, Brian Connick.
Good morning. 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 Good afternoon, everybody. First and foremost, I would like to thank Dr. Gupta for recognizing Sullivan County's need to be designated a HIDTA area. So thank you. I'd like to thank Senator Schumer for his unwavering support for our efforts for this designation. I'd like to thank HIDTA Director Chauncey Parker for his assistance throughout this process. I'd like to thank Wendy Brown being instrumental in the coordination and filing of this application. And I'd like to thank all of Sullivan County's law enforcement for being on the front lines of this opioid epidemic. There's no doubt that an opioid epidemic has plagued this nation, this state, and particularly Sullivan County. Vast amounts of heroin, fentanyl, and prescription painkillers have flooded our streets and ravaged our communities. In 2019, the Sullivan County's opioid overdose rate was 23.7 points higher per capita than the state average. And the opioid burden on our community, including hospital discharges for non-fatal overdoses and outpatient opioid treatment, was at the staggering rate of 204.8 points higher per capita than the state average. In an effort to understand why Sullivan County was disproportionately affected by the opioid epidemic, in 2020, our local leaders and our law enforcement came together to establish the Sullivan County Substance Use Task Force, comprising of 8 pillars, including the Medical Provider Services pillar, the Hope and Prevention pillar, the United Sullivan pillar, the Policy Reform pillar, the Law Enforcement pillar, the Treatment Program pillars, the Care pillar, and the Veterans Treatment pillar. At the same time, the District Attorney's Office, in conjunction with our partners in law enforcement, have drafted and executed search warrants at a breathtaking pace, seeking to search residences and seize deadly narcotics and firearms found therein. Collectively, these efforts highlight the importance that Sullivan County has placed on combating the opioid epidemic. And as we wage this war, we learned that Sullivan County is a high-intensity drug trafficking area, that Sullivan County is a focal point for the manufacturing, importation, and transportation of deadly narcotics. For this reason, we must bring every resource to bear while waging this war. I am again thankful for Dr. Gupta and all of those who supported this effort for recognizing the need to unlock federal resources to combat the opioid epidemic in Sullivan County. An epidemic that recently claimed the life of a precious 17-month-old child and countless others. This is a war we intend to fight and one we intend to win. And this HIDTA designation brings us one step closer to doing that. Thank you.
Thank you, DA. So we want all the drug dealers, drug traffickers, and other evil people who sell this horrible stuff to know we're on it. We're on it. And you ain't seen nothing yet. Stay away from us. Questions on this subject, if there are any?
Is there a dollar figure that you can attribute to this new HIDTA designation that Sullivan will save?
Well, the New York, New Jersey HIDTA gets a certain amount of money and they distribute it. And that hasn't happened yet, but we'll hear about that soon.
Yeah.
What's the nearest county to Sullivan that's HIDTA designated?
Orange.
Orange.
Yeah,
Okay.
all the other Hudson Valley counties are in it. Orange is in it, Westchester is in it, Putnam is in it, Dutchess is in it. Ulster is in it. Any other questions?
Is there a timeline on implementation?
Very quickly. It's done, and we have the money in the budget, so it's not going to be a lot of hurdles.
And does this put additional boots on the ground, like actual federal agents
It will
here?
be up to exactly what the HIDTA and the local community want, but that's a very real possibility, yes. Different prosecutorial authority in Southern District. It depends what they need. Could be treatment side. One of the beauties of the HIDTA program is it has flexibility because each county's needs are different. We have a lot of trafficking problems because of Route 17. That could get special attention from the HIDTA. Route 17 meaning it's a pathway for drugs. Okay, thank you everybody, and glad to be here on a good day.